Hi, everyone. I'm Dr. Khemlani, and thanks for joining the conversation. The past few weeks have brought with them unprecedented hardships. To our friends and patients in the community, our thoughts and prayers go out to you, the individuals, families, and businesses affected by COVID 19. While this has been a truly challenging time for us all and has tested our patience, our resilience, and our faith, I'm confident that we will get through this, and together I hope we can rebuild to make things better. While we have seen many changes to our way of life, one thing that hasn't changed at Columbia Pain Management has been our commitment to our patients. When I joined the team, I made a promise to my colleagues and my community to bring with me a passion for treating patients suffering from chronic pain and a desire to truly make a difference in their lives. Before joining the team, I practiced in the Northwest for several years, and truth be told, I've been an Oregonian for most of my life. I was born and raised in Beaverton, Oregon, and I went to Oregon State University for undergrad. After finishing medical school at Oregon Health and Science University, I spent 5 years in Southern California, completing a residency in anesthesiology and perioperative medicine, as well as a fellowship in comprehensive and interventional pain management at UCLA. After soaking up some sunshine, my heart and my family brought me back up to the beautiful Pacific Northwest. It's been a blessing to be back home and serving patients in my community. So when the virus hit, I thought it was more important than ever to find a way to reach out, to be able to offer insight, education, and most importantly, hope to patients affected by chronic pain. That's why I'm so excited to connect with you today to bring to you the first edition of Conversations with Dr. K, with intentions of bringing awareness to the therapies and modalities that have made a big impact on the way that I practice, but most importantly, on the lives of my patients. For years, we have struggled to treat patients with chronic pain and offer them sustainable solutions. Some patients have even been told there's nothing that can be done to treat your symptoms, and that's simply not the case. Today, I'm excited to go over several evidence-based and innovative options to be able to help you or someone that you know suffering from chronic pain. So let's get into it. In our discussion today, we're going to cover options that can truly make a difference in treating certain symptoms in patients suffering from chronic pain. The definition of chronic pain is any pain that's reoccurring or persistent for greater than 3 months at a time. We'll go over options and indications for these treatments and hopefully offer insight in terms of which options may be best for you or someone that you know. When it comes to treating pain, it's important to understand that there are different types of pain. Most of my patients never thought that they would have to describe the flavor of pain that they're experiencing. But in order to understand how to treat it, we must first understand what's causing it. From a broad perspective, the main types of pain are mechanical and neuropathic. Mechanical pain refers to the type of pain that may be experienced from the aching joints in the lower back or in the neck. The other type of pain is neuropathic pain, and that's the result of a nerve getting irritated or pinched, either originating in the spine, like with sciatica, or in the extremities, like with peripheral neuropathy. While there's some overlap between the way these pains manifest, they can also be very different, and treating them requires a unique and targeted approach. In addition to understanding what kind of pain you're dealing with, it's equally important to acknowledge the impact that pain has in your life. While some people may struggle with physically demanding jobs, others may simply struggle to take care of themselves at home or perhaps of their grandkids. Part of the conversation is to gauge where you are on the continuum and set realistic goals and expectations to work towards them. Now, if you're tuning in today, it means that you or someone that you know has tried many of these conservative therapies. Some have tried almost all of them, including anti-inflammatories, physical therapy, and even surgery, but are still suffering from chronic pain. Now, while I truly believe a comprehensive approach to treating symptoms offers the best outcome, I also know that many of you have been through countless rounds of physical therapy, acupuncture, tried topical creams and salves, and every variety of medication to manage pain. And as we know, even opioid pain medications do a poor job at treating certain types of pain, and unfortunately don't offer a long-term sustainable solution. So let's discuss some options that you may not be familiar with. Radiofrequency ablation, indirect decompression, and spinal cord stimulation. Radiofrequency ablation, or RFA for short, is the application of a controlled dose of heat to a very targeted area to stop certain nerves from sending pain signals. The procedure is safe and minimally invasive and can be performed in the office setting in less than 30 minutes. This is the type of therapy I would recommend if you've already tried conservative therapies like physical therapy and anti-inflammatories. In order to see if this is the type of treatment that would offer long-term relief for you, we can perform a series of diagnostic test injections to see if this makes a difference in your pain. Typically, the treatment lasts anywhere from 6 months to 2 years, and if the pain comes back, we can simply repeat the same procedure without having to perform the diagnostic test injections. Now, by far, one of the biggest game changers to my practice has been the ability to offer patients the Vertiflex procedure. This small, unassuming device has changed my patients' lives in a big way. The procedure itself targets and treats mechanisms that can cause pain and the issues contributing to decreased functionality, therefore dramatically improving patient outcomes. Now let's go through a few situations from patients that can benefit from this procedure. The sciatica in my legs were so severe, I couldn't walk more than 100 feet without having to sit down. And I can't tell you how many times I've heard, I can't get throughout the store without having to sit down. But if I have a shopping cart, I can make it a lot further. It felt numb and tingly in my hip, went all the way down to my leg and my foot. This started years ago, but it's becoming worse. Now, all these conditions could be due to lumbar spinal stenosis. So what is lumbar spinal stenosis? Stenosis is a gradual narrowing of the space in the spine where the nerves pass through. The narrowing can be caused by a pinching in the lower back where the nerves exit the spinal canal, and that can result in tingling, numbness, weakness, and even pain in the lower back, one or even both legs. Now, patients with spinal stenosis can experience relief by bending forward or sometimes sitting down, especially in a reclined position. Some patients may get relief when they lay down flat, whereas others can't lay on their back for more than a couple hours and often have to get up multiple times throughout the night to change positions or to go sit in a recliner just to get some rest. I've even had patients who have been diagnosed with restless leg syndrome or night cramps whose symptoms are actually due to spinal stenosis. Now, the Vertiflex procedure is a simple, minimally invasive treatment that can provide effective and long-term relief. The treatment's FDA approved and requires only a small incision, probably about that big. The procedure can be performed in an ambulatory surgery center and oftentimes requires as little as 30 minutes to complete from start to finish. Inserting the device does not change the integrity of your spine, and down the road, should you need back surgery, the device can easily be removed. Recovery time is really short with this procedure, and some patients report benefit within the first 24 hours. There's a very low risk of infection or complications because of the way the procedure is performed. And since 2016, over 10,000 cases have been safely performed. Now, the results of this procedure are real. And I can tell you in my practice, I've seen these outcomes. The procedure can result in a dramatic decrease in pain medication because of the dramatic impact it can have on the pain generators. And because it can also improve functionality, patients not only see a decrease in pain, but also an improvement in the type of things that they can do with their life in their free time. Now, the final therapy we're going to discuss today is one that I'm really passionate about because of how effective it has been in changing the lives of my patients. While it sounds like something that's from the future, in a way it kind of is, this therapy has been around for 40 years and originated using the same science that brought us pacemakers. Spinal cord stimulation, in its simplest form, offers a controlled dose of low energy delivered through tiny catheters to help reinterpret pain signals before they're sent to the brain. While the therapy can be really effective at treating a broad range of conditions, at its core, it's a therapy and technology that treats neuropathic pain. Again, neuropathic pain is a type of pain that's caused by issues affecting a larger nerve or many smaller nerves. This burning electrical type of pain can be nearly impossible to treat with conservative therapies, and while medications may help, even the most targeted nerve pain medications may not be enough. Ultimately, this is one of the best and most sustainable modalities we have to help patients who suffer from chronic pain. Here's a short list to consider to determine if a trial of spinal cord stimulation would be helpful for you or someone that you know. Patients who have neuropathic pain in the lower back or both legs. Patients who have had back surgery but are still suffering from pain. Patients who have been treated for chronic pain either by their primary care doctor or even a pain specialist for more than 6 months. Patients who have pain in their back, their legs, and their feet. Patients who have neuropathic pain conditions like complex regional pain syndrome, neuropathy, or even reflex sympathetic dystrophy. Patients who take chronic pain medications and despite that have a level of pain greater than 5. Patients who have tried physical therapy, TENS units, epidural steroid injections, and even radiofrequency ablation, but unfortunately are still suffering from pain. Also, patients who are not candidates for surgery or whose side effects of medications are simply intolerable. Now, this therapy has been around for decades. It's FDA approved and it's covered by most insurance plans, including Medicare. The therapy can offer long-term relief, and most of my patients, after a successful implant, have been able to take much less pain medication because of how much better they feel. Over the last 10 years or so, there's been an exciting amount of innovation in the field that's led through breakthroughs in the technology as well as improved patient outcomes. One of the most exciting and unique aspects of spinal cord stimulation is the ability to try out the therapy and see if it's something that can make a difference in your life. This is unlike most options in medicine. The process or a trial is like a test period where we simply place the catheters through an injection. The procedure is really straightforward and can be done in an office setting with minimal to no sedation. The procedure is kind of like placing catheters for pregnant patients who are needing a labor epidural. Once the catheters are placed, patients can then go home to try out the therapy. Over the next week or so, they can resume their normal routine to decide if the therapy is helpful for them. So, how do we know if the therapy worked? The shorter answer is that you'll know, because we're not looking for a small change. We're looking for a real game changer in your pain and in your life. But there are some questions that we can ask to determine if the trial of spinal cord stimulation was successful. If your pain came down by greater than 50%, if you were able to get through your daily routine with less pain and less hassle, if you were able to take less pain medication, and if you simply felt and even slept better. Now, all spinal cord stimulation is not a one size fits all type of therapy. Using the technology to its fullest means that we can carefully tailor settings to target different areas of pain in your body. Oftentimes, we can target multiple pain areas within a region. Patients also have the option to control certain settings and adjust them to best fit their needs and preferences on a daily basis. The impact spinal cord stimulation has had on my patients has been nothing short of profound. Patients who benefit from this device see a dramatic difference in their pain scores, and most importantly, is what it means for them. One of the most rewarding parts of my practice and doing what I do is hearing the stories of how patients' lives are different after they've received this therapy. Now, for those of you who are still with me, I know I've gone over a lot of information today. I intentionally wanted this presentation to be something that you can go back and watch, but I know that even after seeing it several times, there are still going to be questions left unanswered. The truth is, treating chronic pain can be hard. There are a lot of things to take into consideration and many layers to address. While I can't promise that I have the answer to every question, what I can say is that I'm dedicated to doing whatever I can to the best of my ability to helping my patients. If you're wondering, where do we go from here? Well, that answer is simple. Simply reach out to Alyssa, who's our project manager at Columbia Pain Management. Her email address is on the slide. Let her know that you'd like to set up a visit with me, Dr. Khemlani, or Dr. K for short, and that it's in regards to conversations with Dr. K. For those of you who prefer a phone call, I've listed our front office number as well. To continue to do our part to keep patients as safe as possible during these times, we can arrange for a telemedicine visit where we can review your history, symptoms, and go over imaging and come up with a game plan together. Now, I want to sincerely thank you all for tuning in today and taking the time to educate yourself in a treatment option that may be able to help you or someone that you know. Please do not hesitate to reach out with any questions that you have. I know we're all looking forward to better times ahead. And until then, I hope you stay safe and stay healthy.